Discuss about the venous drainage of the face, and then we can talk about the venous drainage of the neck, head and neck region also. So whenever we are discussing the venous drainage of the face, you must have to know that we must have to study about the facial vein, the retromandibular vein, retromandibular vein, retromandibular vein, and then we must have to talk about how the internal jugular vein and external jugular vein is going to form. So first of all, see this diagram. Uh, First thing what you must have to know, this is our facial vein. Okay, so this long torch, this is the facial vein now. Okay, so this facial vein, first thing what you must have to remember, it is formed by the union of these two veins, which I am highlighting at the moment in red color. So this vein is your supraorbital vein, number one, and second, this vein, this is your supratrochlear vein. So when one is going to form, how the facial vein is going to form. So the facial vein is formed by the union of supraorbital and supratrochlear vein. Okay, so they are going to be at the medial angle of the eye. So at the medial angle of the eye, these two veins are going to join together and going to form the, first of all, they are going to form the angular vein, and then in this angular vein it is going to continue as the facial vein. Okay, now very important thing that this facial vein is have connection with this cavernous sinus. Cavernous sinus, it is your deep venous sinus of the brain. So cavernous sinus connection with the facial vein is very important. It is having connection with this superior orbital vein, superior ophthalmic vein, sorry. So this is your superior ophthalmic vein, and this one, this is your inferior ophthalmic vein. So this facial vein is connected to the cavernous sinus by this supraorbital vein, and it is also connected through this plexus. This plexus, which I am showing at the moment in red color, this is known as pterygoid plexus. So this pterygoid plexus, through this deep facial vein, it is also connected to the facial vein and to the cavernous sinus. So please remember, if there is any infection in the face region, because these veins are connected to the cavernous sinus, so it will provides a pathway for the spread of infection into the cavernous sinus, from the face to the cavernous sinus. Okay, now this facial vein, see here all students, this facial vein is going downward, and I will just stop here at the moment, and now I will continue with this vein. This is our retromandibular vein. Now please remember, this retromandibular vein, it is formed by the union of this vein, which I am highlighting in green color. This is the superficial temporal vein. Okay, so this is your which vein? Superficial temporal vein. And when it is going to join with the this vein, that is the maxillary vein. So maxillary vein and the superficial vein, both are joining together, going to form the retromandibular vein in the parotid gland. Okay, so in the parotid gland there will be formation of this vein. This is known as your retromandibular vein. Now very important thing, this retromandibular, as it is going to coming out of the you can say the parotid gland, it is going to divide into these two divisions. Okay, this division is anterior division. See here, one second. So I will draw it in different color. So this is the dark blue color. This is the posterior division of the retromandibular vein, and this red one, this is the anterior division of the retromandibular vein. Now this red one, which is the anterior division of the retromandibular vein, it will join together with the facial vein. So this one coming here is the facial vein, and when these two are going to join together, it is going to form your deep facial vein or your common facial vein. Okay. So if anyone is going to ask you how the common facial vein is going to form, your answer will be it is formed by the union of anterior division of retromandibular vein plus the facial vein. Okay, so these two are going to join together, going to form the common facial vein, and this common facial vein is going to drain into your internal jugular vein. So this is your large one, that is the internal jugular vein. Now the posterior division, see here, this blue one which I am showing here, this is the posterior division of the retromandibular vein. It is joining together here by this vein which is present behind the ear. So this is your posterior auricular vein. So posterior auricular vein plus the posterior division of retromandibular vein, it is going to form your external jugular vein. It is going to form your what? External jugular vein. So if anyone is going to ask you how the external jugular vein is formed, external jugular vein, it is formed by the union of posterior division of the retromandibular vein and the posterior auricular vein. Okay. Now we will try to draw this diagram ourselves. Okay. So how we are going to draw? See here, all students. For example, this is the nose of the patient. These are the lips. My diagram is not very good, like this, and this is, you can say, the ear of the patient. Now see here, all students, this one vein which is coming here, this is your superficial temporal vein. Which vein? Superficial temporal vein. It is joined together here by this vein. This is your maxillary vein. Maxillary vein. And when it is joined together here, this vein is formed. This is known as retromandibular vein. This retromandibular vein, it is dividing it into these two divisions, like this. Okay, into these two divisions. So this is the posterior division. This is the anterior division. Posterior division, it is going to join here by this vein. This is your posterior auricular vein. So posterior auricular vein joined with the posterior division of the retromandibular vein, and now it is going to form which vein? Your external jugular vein. Okay, so if you draw this diagram with me, you will never ever going to make a mistake. Now see here also, here you have two veins. Okay, these two veins. This is your supraorbital vein, and this is your supratrochlear vein. These two veins are joining together, forming this single vein that is known as angular vein. Which vein? Angular vein. And this angular vein will continues as your facial vein. So this is your which vein? The facial vein. Now this facial vein, please remember, it will join together here with this anterior division of the retromandibular vein. Which vein? Retromandibular. Please remember, retromandibular vein is formed within the parotid gland. And as it is leaving the parotid gland, it will divide into this anterior division and posterior division. And when it joins the facial vein, anterior division, it is going to form here this vein. This vein is known as common facial vein. Which vein? Common facial vein. And this common facial vein, it is going to drain into your internal jugular vein. Clear to everyone? So this is how you are going to draw this diagram. Okay. So this is how the internal jugular vein is formed. Now we must have to understand the internal jugular vein. So what is internal jugular vein? See this diagram. First of all, see this diagram. So this is our facial vein. This is our cavernous sinus. These are the superior ophthalmic vein and the inferior ophthalmic vein connection with the facial vein. This is your internal jugular vein. See, now you must have to know about the important points in relation to the uh, jugular vein or your internal jugular vein. So what is internal jugular vein? Please remember, internal jugular vein, it is a large vein that receive blood from the brain, face and neck region also. Okay, it is taking the blood or receiving the blood from the brain, face and neck region. Okay, external jugular vein, we already discussed about that. The external jugular vein, see here all students, it is your forming behind the, you can say, by the, behind the angle of the jaw, by the posterior auricular vein and the posterior division of your which vein, retromandibular vein. Okay, so this is your external jugular vein. But when we are talking about the internal jugular vein, now internal jugular vein, it is the large vein. It is not only taking, it is receiving the blood from the brain, the face and the neck region. Now how it is going to start here? So this is the sigmoid sinus on both sides. Okay, so it starts as a sigmoid sinus. It starts as a continuation of sigmoid sinus. Okay, and as it starts here, this is the sigmoid sinus, and as it is passing through the this is your jugular foramen. Okay, so it starts as a continuation of the sigmoid sinus and it leaves the skull through the jugular foramen, leaves the skull through the jugular foramen, and then it is going to descends into the neck region, and now this jugular vein, external jugular vein, in the internal jugular vein, this is your internal jugular vein. It is present in the carotid sheath. Present where? In the neck region, in the carotid sheath, along with your common carotid artery and your vagus nerve. Okay, so it is present in the you can say in the carotid sheath along with your vagus nerve and your carotid artery. And then see here, it is going downward like this, and now it is joining together here by this vein. This vein is known as the subclavian vein. Okay, so the vein, you can see it is joined here by the subclavian vein, and when it is join here by the subclavian vein, it is going to form here the, for example, on the right side, it is going to form here the right brachiocephalic vein. Okay, which vein? Brachiocephalic vein. Clear to everyone? So this is going to form here the right brachiocephalic vein. On the left side also the same, it is going downward. This is the jugular foramen. As you already know, through the jugular foramen, your internal jugular vein, your 9th, 10th and 11th cranial nerves are also passing through the jugular foramen. Okay, and when it is going to down together here, it is joining together here by this vein, which is your subclavian vein, and now it is going to form here the left brachiocephalic vein. Okay, and when it is going to join here, so these two are the brachiocephalic vein, and when these two brachiocephalic veins are joining together, it is going to form here the superior vena cava. It is going to form here what? Superior vena cava. Clear to everyone? And now see here, what are the important branches in relation to the you can say internal jugular vein. So there is one mnemonic for the internal jugular vein which you can remember. And what is the mnemonic? See here. Medical students, let confident people in. Okay. Medical student, let confident people in. So what is I? I is your inferior petrosal sinus. Inferior petrosal sinus. P is your pharyngeal veins. Pharyngeal veins. P is your pharyngeal veins. Okay. C is your common facial vein. So C is your what? Common facial vein. L is your lingual vein. S is your superior thyroid artery. M is your middle thyroid artery. Okay. So these are all, superior thyroid vein and middle thyroid vein, sorry. So see here, middle thyroid vein, superior thyroid vein, lingual veins, common facial vein, pharyngeal vein, and then inferior petrosal sinus. All are your draining into your which vein? Internal jugular vein. Okay, so it is a direct continuation of your which sinus? Answer will be your sigmoid sinus. It begins at the jugular foramen, ends behind the sternal end of the clavicle bone by joining with which vein? Subclavian vein. Subclavian vein joined together, it is going to form here the brachiocephalic vein. The two brachiocephalic vein, it is going to join together forming which vein? Superior vena cava. Okay. See this diagram once again. So this is your which vein? Internal jugular vein. So this will be your inferior petrosal sinus, common facial vein, lingual vein, superior thyroid vein, and this one, this is your middle thyroid vein. These are the pharyngeal veins. Pharyngeal veins. Now you can ask me, sir, whenever you are going to studying the thyroid gland venous drainage is superior thyroid vein, middle thyroid vein, and your inferior thyroid vein. Now superior and your middle thyroid vein, they are draining into the internal jugular vein. But the inferior thyroid vein, this is your MCQ. Inferior thyroid vein is draining into your brachiocephalic vein. Please remember it forever. See here in this diagram, this is your inferior thyroid veins. So inferior thyroid vein, this is your brachiocephalic vein, this is your brachiocephalic vein, this is the subclavian vein. It is joining here with the internal jugular vein, going to form brachiocephalic vein. No, so the inferior thyroid veins are draining into your brachiocephalic vein. This is a very important MCQ. Superior and the middle one, they are draining where? Into your internal jugular vein directly. Clear to everyone? So these are some of the points which you must have to remember in relation to the venous drainage. I hope it is clear to all of you.